I'm Dr. Reagan, and welcome back to CRxOWN Talks, your dose of health and healing in Black communities. And in 15 minutes or so, we clear up myths about Black health and break down the healthcare questions you wish you'd asked and the ish they should have told you. Because we're rooting for you to be Black, healthy, and crowned. All right, so Black people make up over 50% of folks living with hypertension or high blood pressure. So today we're talking to LaToya Lucas, NP of over 17 years, owner of her own private practice in Greensboro, North Carolina, and about to be Dr. Lucas in just a minute. Welcome.
Yes.
Welcome.
Hi there.
So let's jump straight into the rundown.
All right.
What's one myth about high blood pressure you want to clear up in the Black community right now?
Okay, so let's just keep it 100. We don't do what we need to do. We have a whole lot of myths. We out here living reckless, living foul, and we only have ourselves. We got to protect ourselves because no one else is going to do it for us. So one of the biggest myths that I talk to people about is that you will never feel when you have high blood pressure. That's not true. That's why it's called the silent killer. Oftentimes, by the time you have symptoms, by the time you're feeling it, it's too late. Things have already happened. So we got to look at the numbers. By the time you're getting a headache, by the time you're getting blurred vision, by the time your chest hurting, by the time you're having all those things, it's too late.
Right.
Or now we're in a fight or flight mode. We got to start taking medicines. We got to do other things. But we could have bridged into this a little sooner if we checked our numbers.
Absolutely. And hopefully we'll get a little bit more into that too about how we check our numbers and what those numbers are supposed to be. Okay? So my next question though is, and I say this almost every episode, Black people are more likely to ... But in this case, have high blood pressure.
Okay, so let's just start with basic facts. We are not biologically broken. We're not broken. We're not automatically always going to have all the things. But there is a combination of genetic factors, lifestyle, the things we're dealing with, stress, limited access to healthy foods, caregiving stress. We're constantly in a fight or flight mode, which affects us with our blood pressure. Because again, stress kills, stress can raise our blood pressure. So I say it's a combination. In my practice, I see stress as a major trigger of blood pressure. All the things, caregiving, financial pressures, discrimination, because we're dealing with a lot of that, health equity, trauma. It just all add up. So yes, there is a biological component, but we have a double-edged sword in the fact that we're dealing with the biological trauma in addition to the social determinants of health that we're dealing with. So over time, all those things affect our blood pressure.
I think that's so true. And even like with trauma, even if you don't experience the trauma yourself, it still has a physiological impact on your body. I was telling people about like all of the Black people being killed by police or law enforcement and all that kind of stuff. That takes a toll on you. You get stressed whether you know it or not.
Well, just watching TV, getting on social media, getting on the internet. I'll use myself as an example. I listen to my patients every day tell me all the things they're dealing with, all the stress, all the trauma. And I know by the end of the day, I'm wired up because I've listened to all the things all day. And we're such a social media driven group of people, and we're watching trauma all day, every day. I hate to even look at the news sometimes because it's always something.
So we have to guard your heart and your ears in our minds. It's part of a stress relief. And then biologically too, there are things that we can do to combat some of that as well. All right. And so you did already kind of talk about this. It's a silent killer. And when symptoms usually come up, you may see a headache. You may see what else?
You may see some change in vision. You may see some nausea. You may see some vomiting. You may see some just overall malaise or I just don't feel good. Where you can't really pinpoint why you're not feeling well. You just feel like I'm not myself. I just don't feel good.
Yeah.
Headaches is a big one though.
Yeah, headaches is a big one. What is normal blood pressure?
Okay, so let's talk about it. Normal blood pressure is less than 120/80. People come in my office all the time, their blood pressure 145 over 95. Like, I'm doing good. I'm like, baby, no. We're so used to things just being out of these far-fetched ranges that we think is normal. Also, I give people credit that 140 over 90 people, I mean, that's old school. That used to be an okay number to have. So some people still think about that. But yes, we're trying to get that number less than 120 over 80. However, I'll take a good 130. If you have a history of hypertension, you're on medications, I'll take a 130.
Yeah, I think it's personalized. The overall goal is less than 120 over 80, but in conversation with your provider, you may, play with the numbers a little bit. But if you don't have blood pressure or hypertension yet, we want to keep you around at 120 over 80 or below. Now, how often should they be checking their blood pressure if they don't have high blood pressure, and how often if they do?
Okay, that's a really good question. So if they don't have high blood pressure, then we're going to say if you're checking your blood pressure once a year at your annual provider visit, that's good, But if you have some hypertension, it's going to start at where your numbers are at, right? Yeah, we're going to look at if you're kind of borderline, you're at that stage 1. And when I say stage 1, I'm looking at 130 or better. You may take it every 3 to 6 months. But if you got that stage 2 hypertension or high blood, and let me use the right, high blood pressure numbers, we're looking at these over the 90s. We need to be checking our blood pressure once or twice a week. And we need to have a home monitor. Sit at your table, sit at your kitchen table and check your blood pressure once or twice a week.
That's good. I know everybody in my family got a
everybody got a monitor. Compete who got the best one.
Now, we know you talked about the different biological things that can cause the blood pressure or lead to blood pressure. Family history is big. A lot of people say, blood pressure run in my family. What should they be doing now to protect themselves, even if it runs in the family?
Lifestyle changes. Lifestyle changes are important. So when I say lifestyle changes, I'm talking about watching what we eat, exercising, not smoking, because cigarette smokes, vaping. A lot of people now, they're coming in and say, I don't smoke cigarettes, but they're vaping all day, every day. And that's definitely affecting their numbers as well. So again, lifestyle, exercising, diet, cutting back on the salt, cutting back on the fat, doing all those things that we need to do to make sure we're here, because we as a people, we're typically caregivers, right? And we can't take care of others if we can't take care of ourselves. And before we put you on some medicine, especially if you're right at that 130 mark, I don't want to just say, we got to hit you with medicine first off. Let's look at some lifestyle changes.
I definitely think vaping, and I want to, at some point, I'm going to do a vaping episode. I'm just looking for the right person, because people vape way more than they smoke cigarettes, and they don't even realize that they're doing it way more.
Way more, because they had that, that you look up and every few minutes they got that little machine up at their mouth. They're not going outside or having to take a break like they did work to, go light up their cigarette, and they're doing it way, way more.
All right, let's talk about white coat syndrome. You hear a lot of folks say, Chad, my blood pressure be fine at home. It's on the high when I come in here.
You've been sitting in my office. You heard my people say that? Yes, they say it all the time. So I mess my people up because I don't even hardly ever wear a lab coat, right? So you can't even use that. I hardly ever wear a lab coat. My office is real laid back and chill. So, but they say it's just even knowing that I'm getting ready to come into a provider's office.
Yeah. What do you say to them about that?
I say, there may be a little component of that to you, but child, we're going to check your blood pressure a couple of times. I'm going to get you in here, let you relax, and then we'll go from there. And I'm not going to discount how you're feeling about it, but I'm going to take it a couple of times so I can show you, it's probably a little high.
All right, now when it comes to treatment, you do talk about lifestyle changes. How do you decide when lifestyle changes are enough or when medication is needed?
If that blood pressure is creeping in that 140 range, we need to look at some medication. And I'm going to be honest, my patient population fight that. And I have to really kind of show them it's a pattern. And then they're like, okay, I'll give in and I'll start my medication. I'm going to do lifestyle changes at about 130s to 135s. I think we can bring it down, weight loss, exercise, diet. But when we're at that 140 range, then we need to look at some medication. Most of my patients, I do have an agreement with them. If I get a blood pressure reading of 140 over 90, they're going to come back and see me in 2 weeks, so I can give them a chance to see if it's gotten a little bit better. Was it really stressed or white coat syndrome or whatever it was when they first came to the office, so we can have a pattern.
Yeah. Okay. Now, speaking of treatment, a lot of folks want holistic and natural ways lately to lower everything, really, like, but blood pressure specifically. You hear people talk about apple cider vinegar, various teas, or other types of herbs. How do you kind of talk to them about what's helpful or what could potentially be harmful?
So I often have to tell people I'm not anti-holistic care. I'm not anti-home remedy, but I am pro-research. I am pro what does the statistics say. I am pro evidence-based. There is no study that I know of that talk about that apple cider vinegar, but there is studies that show exercise, weight loss, decreasing our salt intake, and medications have helped with that blood pressure. So I'm not going to totally negate it, but I also educate them about some of the holistic medications or things that's out there don't do well with certain medications. So if you're on certain medications, that holistic stuff is not FDA approved. So you may get one batch that has a certain amount of something in it and another batch that may have more or less because it's not necessarily FDA regulated. So I'm not anti-holistic, but I am, let's talk about it. Please be honest with me. Tell me what you're on.
Yeah, I agree. I do the same thing because I think, like you said, some of that stuff can also interact with the medication that we prescribe. And so you need to know what people are taking and how it may interfere with something else. Now, once people get on blood pressure medicine, why?
So let's talk about my men. A lot of time my men patients, they stop because they say it interacts with their ability to have sex. Let's just keep it 100, right? So I am definitely want to say, okay, this medication may not work for you, so let's try something different. There's not a one size fit all for every patient. And I often tell them, healthcare is an art and a science. It's not just black and white. And we have to, see what works best for the individual person.
Exactly. I think that's so good to understand that if you're having a side effect from the medication, don't just stop it.
Right.
Talk to your provider, tell them what the side effect that you're having is.
Right.
Even if you don't think that it's related to the medication at the time, because like a lot of men may say, I am having this, but they think it's related to the high blood pressure in general, not necessarily the medication. But if you talk about it, then there are other medications that you can try.
But there's some other things too, money. Medication can be very expensive. They say, well, I feel better now, so I'm feeling better. So I feel better, child. I don't need to take this no more. I'm like, well, you feel better because you was taking your medicine. Now you don't feel good no more because you stopped taking your medicine. Side effects also is a big one. In my patient population, a lot of times they're dealing with whether or not I'm going to eat or take this medication. So that's important to try to make sure we're looking at the cost effectiveness of the medications and finding out, does your insurance have a better plan if we do a 90-day supply? Does your insurance have a better payment if we're using their mail-in pharmacy versus going to the CVS down the street? Do they have a agreement with a certain pharmacy? Because I've seen some medications, I have patients say, well, I have to use CVS because if I don't use CVS, it's going to cost this much, or I have to use Walgreens, whatever. Then mistrust, we as people just don't trust the establishment. And that's why I think it's very important that our population have people that look like us, that can talk to them and, just try to help with the trust factor. So for me, the biggest things I see are people stop it because they say I'm feeling better. People stop it because they can't afford it. People stop it because of the side effects. People stop it because of mistrust. And then they also stop it for sexual dysfunction. So the top, I think that was 5 top 5 things I see.
Yeah, and
Mhm.
that's really good. Everything you just said is good for people in the community to hear, but also providers, right? Like it's particularly in areas that have economic gaps or
Mhm.
insurance gaps. It's on you, the provider, to figure out why patients aren't taking their medication
Mhm.
and you make the adjustment. That's my soapbox. I'll jump off.
Well, I that's a big soapbox that I have. So because of that, I have a nonprofit as well in addition to my practice. And so I have a food pantry, and I house the food pantry actually in my office. So if patients are having difficulty, I have some things, they can leave out my office with a grocery bag full of groceries to help. I mean, it's a little bit, but a little bit is better than nothing. I also tell people, uncontrolled blood pressure is dangerous, right?
Yeah.
It can affect your kidneys, it can affect your brain, it can affect your heart, and it can do all of those things quietly over time. Just stopping your medication without a plan is dangerous. It's dangerous. It can be life-threatening.
That is so good, and congratulations, and thank you for having that pantry. And I think that's something probably should be replicated in all private offices. Is at least a way to get people started on eating healthy and seeing different ways, because we know diet wise, we know that cut back on salt, fried foods, fatty foods, and if you're a provider out there, that's what you document, right? I told them like low salt, low fat. But what should folks know about hidden salt and processed foods that are just as dangerous?
But it's even deeper than just saying, let me check the box, I did this, I told them that. And they, may have a desire to do those things. But buying a uncooked chicken breast is more expensive than buying some chicken nuggets. So people are buying what they can afford. Next, I can get in a whole soapbox about that, because why does it cost so much to have a salad, when I could just go get some chicken nuggets and fish fries on the 4 for $4. I guess, do they still do 4 for $4? But if I'm just trying to eat, so we gotta have, it's one thing for me to say, let's do this, but if I don't offer any solutions help with it, people they're making choices, right? So we just gotta, I like what you said. It's up to us as providers to help them make the right choices, and to really stop and have a talk and dialogue about why you're not able to do that. That goes into my research with my doctoral degree, but yeah, so I can talk forever on that.
I mean, that's really good, because I think that's what people need to hear, right? It's like, I can tell you low salt, low fat, low blah, 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 blah. But if I don't tell you exactly, like when I worked in full-time practice, okay, here, do this specifically. Buy frozen vegetables instead of canned vegetables. That eliminates a big bulk of the salt, right? But they're cheaper often at a Kroger. Is a lot of times they're on sale for $2 versus fresh vegetables would be best, but they often cost more. But I think it's making those types of suggestions versus just telling somebody low salt, low fat,
Or even simply, okay, if the canned vegetables is on sale this week, I don't know, 5 cans for $2, and that's what you got. You got $5 to stretch your meal for the week. Well, okay, let's talk about it. What can we do with those canned vegetables? Are you rinsing them off before you cooking them? Are you putting them in, are you cooking them in that juice that came in the can? What other thing? Think about some other options. Other things I like to do also is to give. I have this little brochure I made up that talks about, when we go out to eat, how to eat healthier from the restaurants or the fast foods, if that's what we have, healthier choices when you're going out. So, and I also try to give them some meal plan and prep and materials as well.
That's awesome. And great to have those types of resources that are readily available for people to, be a quick reference.
That's true.
Now we reach the rapid fire round. So first thing that comes to mind,
okay.
What one food you wish people would eat less?
Ooh, one food that I would think that I would like people to eat less. Let me think. Wish people would eat less salty French fries.
Although it's so good. One habit that raises blood pressure more than folks realize.
Poor sleep.
Interesting. One thing that helps lower blood pressure fast.
Deep breaths, breathing exercise techniques.
What's the most serious complication you've seen from untreated hypertension?
Ooh, a stroke. Massive.
Best advice for someone newly diagnosed?
Don't panic. We can control it. Let's get together. Let's get some education.
One word you associate with heart health?
Consistency.
Ooh, love it. What's the right way to take your blood pressure at home?
Ooh, that's a good one. So you want to sit quietly for 5 minutes before you do it. Make sure your feet are flat on the ground. People like to cross their legs, have they lean on their legs as crossed, so we don't want to do that. No talking, no joking. Keep your arms supported at the level of, like you can see me, at the level of the heart, and empty your bladder.
Yep. All right. Great.
I got one more. I have one more thing. I want to think about when you asked me about the foods, processed meat as well.
Processed meat is huge. Again, it's convenient, free, not free, but cheap. Now, before we close out, what's one step someone can take this week to better control or prevent high blood pressure?
One step that someone can take this week to better control their blood pressure is to be able to know what your numbers are. So in order to know what your numbers are, you need a monitor. So buy a home blood pressure monitor so that you can check your blood pressure at home. That's the start. That's the one thing I think people can do. Educating themselves to know what their numbers are.
And some insurances will cover the blood pressure machine, right? So some people can go through their insurance as well.
And if they got a provider like me, they may have some blood pressure monitors in their office that they may can donate. Look, they'll donate to people if they have somebody that's equity focused, culturally sensitive, and competent as their provider.
So everybody out there, that's what you should be looking for. Pretty focused, competent. I can't repeat it, but y'all heard it. Somebody y'all need, okay? So thank you, newly Dr. Lucas, for joining us today and sharing your wisdom. And to everyone listening, here's your crown check for today. High blood pressure is common, but it ain't normal, okay? You know your numbers and protect your heart. We out. So this has been your health check-in with Crown Talks. If you love this, follow us at all major platforms and like, share, and subscribe. We'll see you next time.
Bye. Peace. Put your crown on.